the kind of care that you know you need to plan for healthy pregnancies later.
And that web page is www.modimes.org,
Right.
O-R-G. And one of the things I think helps is that when you go to a doctor, whether it's a preconceptional visit or whatever, they're going to ask you questions. And my usual answer is, I don't know, or I take a little yellow pill, or whatever. We don't know the answers to many of the things that we might want to know. So I think one of the really good things about getting information is to be able to ask about family history, diseases, things that could be a problem, so that you really need to do your homework.
Right.
So that when you go to that preconception visit with your doctor, that you could say, I need to talk to you about some of these things in my family, in my partner's family history. This is what's going on with us. What can I do? And now this could be an obstetrician, a family practitioner, an internist.
Yes.
Any of the above should be able to help prepare us for having a baby.
Right. They really can be very, very helpful. And hopefully they're going to do this about a year before. That would be ideal if everyone would plan for a year to have a baby. I know that's not always possible, but that would be ideal, so that you take a whole year to really get your health in order, get your life in order, get your finances in order, maybe finish schooling, find good careers. All of those things are so important, not just the physical, but the other emotional and financial obligations that it really takes to have a baby.
And if the emotional and financial isn't in place, if the father is not going to be there during the pregnancy and during the rearing of a child, again, these things cause stress.
Oh, exactly.
And stress causes problems when you're having a baby.
But you need to be very upfront about these things, because there are solutions to most of the problems, and the resources are out there. But until professionals know that you have needs, we really can't do a whole lot to help you. So if people would call us and find out the resources that are available, we're always ready to help.
Now, one of the things that we overlook a lot is dental health. And we should
Very
also
important.
make a visit to our dentist, because if you aren't flossing, if you have gingivitis, an abscess or something like that during your pregnancy, this can cause harm to the baby.
Any source of infection can be a reason for preterm labor. We know that poor dental health has a very high correlation with preterm labor. So getting a preconception dental visit is also part of really good planning, and just having good dental hygiene. That includes good nutrition as well as good dental habits.
And then we also need to think about vaccinations, because there
Yes.
are chicken pox and rubella, and some of these diseases can hurt a baby if you would get them while you're pregnant.
Right.
So that is something that you want to do in advance. And if for some reason you haven't had chicken pox, or you know, that health history is very important, and it's important again to know that before you go. Infections, and we think of AIDS, but infections really do have a great bearing. And a lot of times the sexually transmitted diseases
Yes.
that you have or that your partner has, again, you don't know about. So that you really do need to go. In fact, a law was passed in Illinois that a doctor needs to offer an AIDS test
Yes.
to every pregnant woman.
Right.
But in fact, the time to have an AIDS test or to be tested for any infections that would come from a sexually transmitted disease is prior to thinking about having the baby.
Before you even want to get pregnant.
There are so many things to consider that we can't cover them, you know, in a 26-minute program. But as we summarize and, you know, leave our audience with some practical things to do, Cindy, what would you say are the most important things that we need to know about before we get pregnant?
Nutrition. I can't stress nutrition enough. good nutrition is really key to good health. Talking to a healthcare professional about risk factors in your life, taking that multivitamin with the
Folic
acid.
And if your doctor says that you have a problem, you can take up, he may say you need more than that. That's just a
minimum.
You may need to have more.
Right. And prenatal vitamins are usually a very good source of the folic acid. So the healthcare provider can tell you which prenatal vitamin they think would be the best for you. Taking a really long, hard look at your life and deciding, are you really ready to have a baby? That's probably the one key issue, and everything else pretty much falls in place after that, because if you're really ready, if you're in a healthy relationship and in a healthy lifestyle, then many of these other things will sort of fall into place. But that preconception visit is the time to find out and really take a hard look at some of these issues.
And if we do this preconception visit, that pretty much keeps us thinking, you know, all right, we need to know these things. But if anybody has any questions about preventing birth defects, even if we don't have the slightest thought about having a baby, but if we are of childbearing ability, this could happen. They can call the March of Dimes, or they can call the Resource Center at St. John's Hospital. And again, let's have the number.
535-3696.
And always we can call the Parent Helpline. Sometimes we just need to talk through issues in our lives, and the Parent Helpline is there to listen, to support you, to tell you information, to send you information. We can get you in touch with all of the wonderful March of Dimes products that they have and the handouts, and really help you get ready to have a healthy baby. And Cindy, you see the joys of birth, and you see the results of
poor care.
And let's just talk a little about what are some of the cases. I mean, spina bifida, when you have a big hole in the back. In studying for about preconception, you see these. What are some of the problems that we're trying to avoid?
Well, we're trying to avoid children with lifelong disabilities, and many of these defects of the brain and spinal cord can lead to mental retardation, to paralysis, lifestyles for these children where they are never able to really move like you and I do. They often have to have constant care for the rest of their life. And the burden on society, the burden on the cost for the family can be astronomical, and can be so easily avoided with healthy lifestyle choices, and especially with the folic acid.
Women like to be in control. Everyone likes to be in control of their lives. And many things we can't do something about. But trying to minimize the worry and the anguish that can come from bearing a child that has birth defects is something we do have more control over than we thought we did.
Exactly.
And so I guess in parting, we want to say to make sure that you do take control of your life and your body, and make sure that you are in the best of health, avoiding things that hurt your body, avoiding alcohol and drugs, being good to your body and getting into be an ideal weight, taking folic acid, and doing everything you can to make sure that you can have a healthy baby. And Cindy, thank you so much for sharing your expertise, and we will keep learning, and we are always available for calls or comments when it comes to preparing to have that wonderful little baby that you want. Have a good day.